Hello everyone and welcome to sqadia.com. I'm your educator Dr. Ali Imran and today's lecture is about breast imaging. So in this lecture we will learn about the mammography. What is mammography? How it is done, what kind of x-rays are used, what kind of projections are used, what is a screening mammogram or what is a diagnostic one. We'll learn about it all in this lecture. Then we learn about the standard views, the projections of a common mammogram. That is both the craniocaudal view and the mediolateral oblique view. What is their difference, what is their similarities, why one view is preferred over the other, what is their similarities, everything we'll learn in the lecture. Next, we'll study about the breast densities. Now, what constitutes a normal breast densities, what are its types, how it can be different in different patients, and how it can be different when it starts to show characteristics of tumor. Now that tumor can both be benign or malignant, but what constitutes a benign tumor or a malignant tumor? We'll learn it about all in this lecture. Then the screening mammogram, as we already talked about. Then we'll learn about the diagnostic one, that if it is benign, what kind it is, what makes the adipose different from a fibroadenoma, what causes the false negative mammograms, what is a cyst, how is a cyst different from a developing density, or if there is no density of mass, then what does dimpling on the skin signify. We'll learn it all in the diagnostic mammography, and we'll also learn about the classification system, the BI-RADS classification system. Then we'll learn about the ultrasound findings. Now in breast imaging, primarily we use mammography, and mammography uses low dose x-rays. But it's not the only one. We use ultrasound. But why do we use ultrasound? We'll learn about it. What makes ultrasound superior to a mammogram? What makes it inferior to a mammogram? In which conditions ultrasound is done? In which conditions a normal mammogram is done? We'll learn it all in this lecture. The other outline that we'll learn is about the patients. Now, usually we deal with low-risk patients. Even low-risk patients have to undergo yearly mammograms. But what constitutes a high-risk patient for whom yearly mammogram is not enough? For that person, what is our methodology? What is our treatment plan? How a high-risk patient differs from a low-risk patient? We'll learn it all in this lecture, and this is only the outline of it. Now, if you go to sqadia.com, you'll find thousands of medical lectures on a variety of topics, from radiology to gastroenterology, from biochemistry to anatomy, to physiology, to forensic medicine and toxicology. You'll find lectures on every subject, and there are thousands of them. You can even start your free trial. You don't have to pay anything. Your first month will be free. Your first videos will be free if you start today. So thank you so much for watching sqadia.com. I'm your educator, Dr. Ali Imran. Thank you so much.